Let me know when I start this meeting of the EMS Task Force. We have no minutes to approve. We have no really agenda. I was asked to hold this meeting because we're into a situation where EMS providers are hard to come by. Most agencies are struggling to find a stable workforce to fulfill their needs of the community. So before I start, I just want to read what our goal was in 2018. The goal of EMS Task Force is to create a plan designed to provide consistent, affordable, quality service and care to address the emerging problems with EMS delivery within the county with long-term sustainable solutions. That was March 2nd, 2018. And now here we are on October 7th, 2021. And we haven't done a bit of this. We had a lot of chatter, but we have not had any results. So this past summer, I've been getting questions. What could we do? What could we do? I did attend just a meeting with the incoming supervisor for the town of Horicon, and North Warren EMS agency is struggling finding providers to fulfill their needs for their scheduling. And then recently, Supervisor Leggett asked me if we could schedule a meeting to discuss this. So that's where we are today. It's an emerging problem. COVID kind of derailed us getting together in 2020 to discuss it. But I have some suggestions which are on the backside of your agenda on what I think we need to do. But these are strictly my opinions. It doesn't mean that you will agree with me, but I think everybody will agree that we are having a shortage of providers.
Kevin?
Yes.
For those in the audience who don't already have it, the packet at the front desk there has that.
Yeah, there should be some on the table if you need to look at it. Sorry about that. So, not enough providers. I think most of the EMS folks in the room would agree with that. So how do we combat that problem? My opinion is we need to establish a county-wide EMS system to provide a workforce that would satisfy our needs as far as providers. The reason why I say a county-wide EMS system is because if every community created their own EMS district, you would still have problems drawing from the same workforce. A lot of these providers work in the different communities currently, and they're going to move from community to community based on what they make. Why wouldn't they? These are positions, usually these are positions that provide no benefits for the providers. They work long hours to make a living. They get no vacation. And I think it's time that we really address the issue by coming up with a county-wide system. The problem's not going to go away. You know, we always hear the phrase, we kick the can down the road. Well, we have, quite frankly, because at the time, we didn't seem to have cohesiveness amongst the squads on how they wanted to do this system. But I think a lot of them put a lot of hours in trying to provide the best service to their communities, but they're just running short of providers. And to keep making it a bidding war between agencies, I don't feel is right. So that's basically what I have today to talk about. And then I have some other details, but that's to be worked out by the committee. I would like consensus from the town supervisors, and I'll ask the the audience here if I've captured what the problems are. So Supervisor Hogan, you had your hand raised.
Thank you, Mr. Chairman. Before we discuss a countywide initiative, does anybody know what the status of Assembly Bill 5793 is? That's the one that would allow municipalities to offer health insurance and other benefits to volunteers.
I have no idea.
I can look that up.
Okay.
Thank you, Ryan.
Okay. So I don't know, Supervisor Leggett, if you would like to reiterate the problem you're having in your community or your agency may be having in your community.
Yeah, thank you, Mr. Chairman. You stated the problem succinctly there. We're all aware of it. And there's, call it price wars going on. But the fact of the matter, and this started back in 2018, is that we really need to recognize that this is a career track that we have migrated. Most all of our agencies have migrated from fully volunteer to all paid or at least partially paid. And the requirements of the EMTs, paramedics to be able to provide these services, there's a lot of training, there's a lot of time that's involved in that. So it's really recognizing the situation that in order to create a stable force that provides a vital service to our residents, that we need to come up to speed. And part of that is the providing of benefits and a job security and a career track on these things. And together, when if we do this in a unified manner, we can develop an economy of scale. At least that's the plan of it. So this is why it's before us right now. So our agency, North Warren EMS, that we share with Horicon, we have the EMS board member and candidate for, unopposed candidate for Horicon, Mike Gerasi, with us here today, who also comes with a lot of expertise in this area, coming from Connolly and having been involved with that transition down there for their squads. That's all I have for right now.
Yeah, I do think, you know, I've thought long and hard about this. We need a funding mechanism. The funding mechanism would be a countywide district. By no means would we force the full county if they didn't want to partake in the district. A community wouldn't have to partake in the district. If a community is satisfied with the way their agencies are running right now, so be it. But there's a lot of communities that are struggling right now. A lot of communities, I think, would join this district. We've heard from Albany County. We know that it started small in Albany County. And then eventually some of the bigger communities that were running their own came into the fold in Albany County. I believe they did. I'm not talking about spending $3 or $4 million to do a startup. Our agencies that we use right now have all the rolling stock they need to work with Warren County. What they seem to be lacking is finding enough staff. There is a way that we could work with these agencies as they're made up. They could lease their equipment to the county. They have their facilities, which they could lease to the county, but the county could provide a pool of staff to work in these communities. So those are some of my ideas. I didn't want to get too far into it because I want to hear from the agencies, and I would like them to step up and if they would just state the name of what agency and see if I've captured the problem, what I see correctly. Yes.
And if I may add here on the finances of things, that in the general fund for the town of Chester, including the EMS, it's 42 cents a thousand. And if we take EMS out of that and say, add it to the county tax levy, it would reduce our taxes to 25 cents. That means that 17 cents out of our tax levy is devoted to EMS for the town of Chester. And we share that cost with the town of Horicon. So they also put in there. So EMS has a big economic impact on the town, and we are hoping to be able to find a way where we can be more efficient, economically efficient on providing these services.
So would any of the squad members wish to address, or somebody, just please step up to the podium and state your name if I have no objection. Yes, Supervisor McGowan, you had a question.
Yes, thank you, Chairman. I remember Supervisor at the time, Chairman Conover brought this up, is working toward this direction. And, you know, one of my questions is how are we as the county going to find employees that aren't already trying to get involved in one? You know, we're going to supply them. I believe this is an essential care that we need to offer our people. You know, all joking set aside, I just remember growing up with Station 51, you know, the TV program, but Squad 51 was the important part, where the pre-communication and the pre-prep work of bringing that person to that hospital, you know, increase the survival rate. And I've seen these paramedics and they work hard. I really believe I would like to move forward and make it, but how do we do that? And should this be put out to the taxpayers, you know, for a vote to get their, I mean, which I do believe they'd probably stand behind, but you know, in all fairness, is, you know, is that a route to go? But you're absolutely right, Kevin. These are essential things that
I got you.
we need to move forward on.
Okay, Supervisor Bramer.
Thank you so much, Chairman. I'm not on your committee, but I just wanted to weigh in from the, you know, a county perspective, what I'm thinking about. Of course, these are really important services and we want to make sure that we keep talent in our county. One thing that's going through my mind is like the price tag, but just setting that aside, like how do we make this work? And how do we make sure that we are sharing services appropriately? And one of the things, your bullet points about, you know, not everyone would have to opt in to the program. But that gives me a concern that, well, then if we're doing that, we still have a patchwork of different systems around the county, and won't they still be competing for staff if we continue to have these different little services in various communities? And then of course, one thing that's going through my mind is how do we wrap Glens Falls into this, or don't we? So it's a lot that I know we've been talking about it, but I haven't really dug in a while, since we haven't brought this up at a committee level in a while.
Well,
thank you.
Okay, I'll answer your questions to the best of my ability. I can tell you that the city is a, you know, professional fire department, that those members, I believe, have to be ALS techs or when they become members of the fire department. And so the city is set, but they do provide a lot of mutual aid calls for the surrounding squads coming into the hospital. So there is an expense to the city that, you know, is picked up by city residents only. The question about how do we would know that we would attract people to join? Well, if there's a job that pays benefits, if there's a job that gives them, and it's a decent rate of pay, if there's a job that provides them vacation time, and if most of these people have a passion to do this on their own, and they're doing it now without providing any benefits, without providing any time off, I think we could attract more people to get into the profession. You know, I can't guarantee that. I don't have a crystal ball, but I think it's time that that's what we need to do. You know, this is just the tip of the iceberg. I mean, we've waited and waited and waited. First, we worried about the different squads and the different personalities. I think now most of the people trying to run these squads on their own I find big challenges now, and they've come asking for help. So I think it's important that we listen to them. And these are strictly my opinions. You know, I've been around for a long time as a volunteer, and I've seen it evolved. You know, when it first started, you poo-pooed it, but it's grown. EMS is not recognized as a vital necessity in communities like the fire service, and it should be. So I think it's time, but we have to join together as a group and make it work. I think some of our proposals were granulous, creating numerous administrative jobs. That's not what I'm all about. I'm all about is providing providers to the communities so that people who call 911 can expect that they're going to get an ambulance in a reasonable period of time. It's going to take a lot of work. Will there be bumps in the road? Yes. Will everybody be happy with this? No, I don't expect they will be. But it will work out if we all work together. And I think we're at the point where most of us want to work together. Supervisor Molino.
Thank you, Mr. Chairman. Most of you all know I've used the emergency squad in the last couple of years a lot. I've learned a lot from the inside of the vehicle and what these gentlemen and these ladies do for us. I'm all for what you're saying. I think if we can mobilize at least, because most of these gentlemen and ladies work 2 days in Lake Luzerne, 2 days in Lake George, 2 days in Warrensburg, but they don't get that vacation that you're talking about. They don't get that insurance you're talking about, and they don't get the extra pay. Now in Lake Luzerne, we just raised, in my budget for 2022, $85,000 just to give them more money to keep it equal what everybody else is doing, because we're stealing from each other. And so if we can get the force like you're saying, we will hire, more people will take the job when they get better pay and a lot of benefits and know that they can have a week or two vacation here and there, because some of them probably work 7 days a week. So I'm all for this. And I think a county-wide idea, especially with the pay and benefits.
I know just before we move on, Administrator Moore has the information on that. What bill is it?
Sure, it's Assembly Bill 5793, correct? Let me give you briefly what it would do. It authorizes a $400 tax credit for volunteer firefighters and ambulance workers who've been active for 4 or more consecutive years, as long as they're not already receiving property tax exemption for their services. It authorizes the fire insurance premium currently charged to foreign mutual fire insurance companies for the benefit in part of fire companies to be used for volunteer recruitment and retention purposes, including contributions to the cost of their medical insurance of the volunteers. It exempts from registration and vehicle use taxes the motor vehicles owned and used in the performance of their duty by volunteers. It amends the current provisions of the volunteer recruitment service scholarships so that volunteer organizations can submit the name of up to 3 qualified candidates. And it creates a volunteer recruitment service loan forgiveness program. Is that the legislation you're?
I thought there was something in there about municipalities being able to cover insurance.
Not according to the bill memo.
Thank you.
But that particular bill is that is in the Assembly Ways and Means Committee since February 25th. And the Senate companion bill is in the Budget and Revenue Committee since March 5th. This is a minority bill in both houses.
Supervisor Leggett.
Thank you. Just a quick clarification. You had mentioned about considering EMS vital. We consider it vital. It's not legally an essential service. So like garbage, fire.
Or dog
and
warden.
police and dog warden.
So anybody wish to address from the squads or Mike? State your name for the record, please.
Sure. I'm Mike Gerasi from the town of Horicon, a member of the Horicon Town Board, the candidate for town supervisor, and also a board member for North Warren EMS. Very grateful, Chairman Garrity, for your leadership and the subcommittee members for discussing this issue. It is an absolute paramount concern to all of us. And I'm really pleased to hear the positive comments that are coming from all of you. The important thing to remember about EMS, obviously the staff and the training and resources. When an individual calls 911 for EMS, it's very likely it's the worst day of their life. And the services that they're looking for and the expectation that they have is that a skilled professional is going to arrive and provide the service that I need, possibly to save my life. We'd like to believe that that takes place in all of our communities. The reality is, in today's environment, it's very difficult to do that. I have 45 years of public safety service. Started it as a volunteer firefighter and a paramedic in the town of Connolly, and many other roles through those years. So I speak from personal experience, but also now as a governmental leader with concerns for our residents. So whatever this subcommittee can do to move this forward, I recognize that there's been a lot of discussion over time, but it's time for movement. It really is time to come together and look at the potential options. The question about competing staff. This is a career path that we want to create. This is not a part-time in Horicon and a part-time in the Warrensburg 3 days, and I have no personal time, but really we're looking to build this as a professional career path. So I offer my personal assistance in the town of Horicon, whatever we can do to move this forward. You have our commitment to do that, but we are very, very thankful that at least this discussion is at the phase it is right now. And I extend my thanks to the providers that are here as well for the service that they offer to us on a daily basis.
Thank you. Any of the providers wish to address the board?
How are you guys? Tom Ordway, Local 2230 President. I want to thank the City of Glens Falls supervisors because they've been extensively supportive of us, especially in the EMS department. They've encouraged our training. They've encouraged us to pursue further avenues of the ambulance service and the EMS service. And even though it's not an essential service, they treat it as if it is. So thank you guys for that. I've been working in EMS since I was 16 years old. So I've seen it from all angles, both as a volunteer, as a career firefighter with the City of Glens Falls. The biggest thing that we see is the lack of accountability in other agencies. We have a fire chief, we have a person that we have to hold accountable to, and that is not seen in other agencies. I don't want to bash any other agency. I don't want to bash anybody here because we all do virtually the same job, but you have to have accountability. Without that accountability, it's not going to happen. Sorry, I have a couple notes written down. I want to say the last, again, don't quote me on these numbers, but the last numbers that we knew of, we were, the City of Glens Falls was writing 6% of calls to mutual aid services. So we are using 6% of our time for, I believe it worked out to be 1 out of every 12 calls we were doing was for a neighboring town. It stresses us. It stresses the entire system. What mutual aid agreement is for is to assist when all other avenues are exhausted. We've been acting as a second ambulance for neighboring agencies. We've been acting as a primary ambulance for neighboring agencies. And again, we're not complaining. We're happy to do it. But at the same time, it's not fair to the taxpayers who expect us to be there to answer their calls. It's been mentioned career path. Again, before I was hired in Glens Falls, I was one of those guys. I was jumping from 3 different agencies to make a living out of this. The pay isn't there. The benefits aren't there. Until that's addressed, it's not going to change. Again, I want to thank Glens Falls guys, especially if you've been super supportive of us. So thank you for that. And we're also willing to help any way we can to support this system, obviously from the union side. I'm sure the city would feel the same. So
Thank you.
we definitely want to help.
Thank you, Tom. Sure.
I'm Joe Connolly. I'm the director of Johnsburg Emergency Squad, as well as a full-time paramedic. This is great to hear all this talk and discussion. You know, it's long overdue. And it needs a lot of discussion because there's a lot of things to balance here. You know, and each town has different needs and different resources. And in Johnsburg, we've been working really hard at making the best of the resources of, discovering the needs and finding ways to meet them with what we have. And it's been tough, but we established a tax district in 2015, and we've had tremendous support from our community and from our government. And in doing that, we've been able to keep our thing going. So we have 24/7 paramedics. We haven't really missed a paramedic on duty in 10 years. And that's just taken enormous amount of work from top to bottom. But we're very lucky. We've worked hard to attract paramedics to live here. We have 5 paramedics living in our town. And we have a big squad still of people working, contributing in any way they can. And I'm just a little worried about losing that community of EMS that we have and that we've worked so hard to get. At the same time, though, we are hitting a wall with being able to provide these people with what they deserve. They're professionals. They deserve to have benefits, and they deserve to have vacation. We've been able to give them some, but they need more. I don't know if we need an entire new bureaucracy, but we need funding. We need funding to be able to give that extra money, those benefits to the people who live and work and take care of the neighbors in our town. That's really important. Either way, whatever the final decision, I'm just glad we'll keep talking and we'll find a way to get there. I thank you for doing this.
Where you go?
That's, yeah, sure.
On the Johnsburg squad, you incorporate volunteers, and do they get a stipend?
We realized it's really hard to balance volunteers and paid employees because Department of Labor laws, and so we do offer everybody's an employee. So everybody gets paid something. We have on-call rates for night drivers. So those night drivers are paid an on-call rate. And then if they show up, they're paid for that, and that's what I mean about every town is different. Every town has different needs. We've been able to succeed with that model. But, and that also gives a way for people in the community to still help be a part of the squad and the family.
Thank you.
Sure.
Supervisor Beatty?
Yeah, thank you, Mr. Chairman. I applaud you guys. Thank you very much for coming. Your input's invaluable. I'm still trying to get a handle on some of this. So you're asking, should we make all the EMS employees county employees? Is that the first question I have?
No, what I'm suggesting is we create an EMS district. That's the first thing you need to do. You need to find a way to pay for, if we went to the next step, to make EMTs or ALS techs part of a countywide system. So you need to, before we can do anything, you need to have to figure out how you're going to pay for a system. If we create a district, then you can put a tax on that district to develop an AMS pool of EMS candidates to run the district. So yes, after you find a funding source, then I would suggest that we create a, well, I don't know what I would call it, an EMS district. And yes, the people who work on the EMSs would be employees of the county.
Okay, if I may. So,
Yeah.
Okay, so
I apologize. It's easy for me because
Yeah.
I've been doing this.
you've
for
been
so
doing a
long.
lot. So a funding district, okay. Now you mentioned that the town, city or the towns can opt out. So if they opt out,
Mhm.
is that they're not then liable for the funding of the district?
That's correct. It would be sort of like the old Warren County Sewer District that was created. In your community, if you were part of that sewer district, it's like you flip a toggle switch. Those people who get taxes in that community, they would get an EMS tax charged to their bill based on whatever the rate we would apply. It would be a separate rate. And I remember when they did the sewer district, that's what happened. Any community that was included in that county sewer district, you would flip the switch on your bill and you would pay a portion of that, whatever the expense was for the county sewer district.
Okay, so, so say Glens Falls and Queensbury opted out, those are
That's correct.
66% of the county.
Mhm.
So you're saying 34% of the county would have to fund that EMS district.
They would have to contribute. There are other ways other than just taxing to contribute towards the funds.
But I'm trying to get a grasp on this financially. Now, have you run a cost benefit analysis on adding X amount of people in that line of work to our county self-insurance program? And what type of costs are we looking at there? I
We
got
have.
a lot of financial.
We haven't dug until we get buy-in from the communities. You can't do that until you know who would be interested in joining us. Once we find out, then we would have to get a staffing analysis by community and how many people you would have to hire, and then you'd have to look at it. But I think it's very doable through an EMS district. Plus, the fact is, each of these runs are billed for. So there's revenue through billing of the service.
Yeah, I'm just.
But I couldn't tell you because I don't know who wants to belong. Once we find out who would want to belong, then we could figure out how you would have to fund the total amount of it.
Okay, so let's assume 50% of the county wants to belong, 50% doesn't. Okay?
Mhm.
So then at that stage, you'll then run a cost analysis with our insurance company to determine if those towns allowed those EMS people to be county employees, how does that affect the county insurance rates? Is that correct? Is that what I'm hearing? I'm just trying to figure this
I'm
out.
lost about that. Go ahead.
Are you talking about workers' comp?
Well, I'm talking about workers' comp, which is probably a fairly high, just insurance costs in itself, because
Yeah.
the liability aspect probably is fairly significant.
In my head, in terms of how to budget for it and how to account for it financially, for the workers' comp, those costs are all charged out based on the participant. So, for instance, my department will have the formula that we utilize is based on the size of the department and the experience. Same for all the towns that are members of the workers' comp pool, based on the size of the town workforce and the town's experience with claims. So the costs, to the extent the costs for workers' comp would go up as a result of this, you can allocate those back out to the district, if that's the terminology we're using, so that the district pays full freight and it doesn't affect anyone who's not a member of the district. And likewise for the regular property and casualty insurance, we do an allocation. Costs that are not able to be allocated are paid basically in the budget that the clerk of the board has oversight over. But for the most part, our insurance costs are allocated out to the cost centers that produce them. So that would be the concept I think that you would have to apply. The concept here is that there would be certain municipalities that would belong and certain municipalities that would initially not belong. And you would contain all the costs solely to the ones that would belong, and you would hold harmless the ones that would not belong.
And they currently are members and they currently pay now, Doug.
Yeah, I know. So I'm trying to get a handle on all this. I know Jack has a question. Maybe Jack can help because he has a lot of experience in that arena. So if it's
Sure.
all right, Mr.
Sure,
Chairman,
go ahead.
Mr. Diamond.
Thank you, Mr. Chairman.
Mayor.
I think the outline that you've created here today is realistic talking points. I don't think you're asking us, or you're not in a position to answer questions, but
Not
it's
detailed.
a draft to proceed to advance this further on. I like the fact that you've included options in this draft where if, for example, the city of Glens Falls has their own EMS program, that they can stay independent, they can stay within the city of Glens Falls, that they don't have to participate. I like that concept, but I think some of your talking points that you've had, you put on this paper here makes sense. to continue with this dialogue down the road. I
Right.
think your point you well made that in 2018, this was discussed. Now it's becoming more of a reality where we're going to be able to discuss this in greater detail going down the road. So I think this is a good first starting point.
And that was the whole idea is
I'm
that,
willing to participate in this, in greater lengths. Once, and then we can establish, or answer some of the questions that maybe Supervisor Beatty has.
Yeah.
Or we may have as we engage into this dialogue in greater detail.
but we do need, we kind of need to know who would be interested from a town standpoint, who wants to do it.
I think the only way you can do it is to come up with the concept of creating a taxing district. And those that don't want to participate, similar to the septic law that we're going to be talking about, they don't have to.
They don't have to.
And they.
And-
and the state's-
So a lot of the financial aspects of it can't be answered to, I know,
Until
who
you
would
know
consider,
Right.
who would want to be considered to join it. And then we could take their assessed value, add it up. We can go to Anne Marie and EMS over there and ask her Office of Emergency Services to contact the communities who want to join, get what they feel their staffing needs would be to run a paid service 24/7, 7 days a week. And then we'll have more to do. But I can't sit here today and say that. But I do know some of the questions. All the organizations really are already into workers' comp and those type of things. They already pay into workers' comp based on how they do it. I can't see where that would change a lot from what they're doing right now. Supervisor Hogan, you had a question.
Thank you. I'm very much in support of stabilizing our workforce, especially in the EMS realm. I know how much of a struggle it's been because I've been working very closely with our own. I would just caution this committee from passing any resolutions to advance this at this point because we simply have too many unanswered questions. I share Joe's concerns about adding another level of bureaucracy. And I also have concerns based on the proposal in front of me that, in a town like ours where we already have paramedic coverage, we don't want to see that reduced in any way. We don't want to go to an EMT system. So we need to work out expectations among the varying communities. To Supervisor Beatty's question, and correct me if I'm wrong here, guys, can you if somebody in a neighboring town has a call and there's no one to respond, can you say, no, we're not coming?
In a mutual aid system,
Well, just in any system.
so legality wise, I don't know. We just always go.
Well, we have mutual aid companies. Yeah, all our neighbor towns have to have those. mutual aid. But at the same time.
Yeah.
So
So it would be a refusal based on what services might be left on.
Why don't you get up at the podium so we all can hear that? Answer.
My name's Damon. I'm a firefighter with Glens Falls. To answer briefly, I'll use the city of Glens Falls, for example. Within our system, we have our primary ambulance in the city, and then we also have our secondary ambulance. If our primary ambulance goes out to a mutual aid call in the surrounding community, whether it's to Washington County or town of Queensbury or anywhere else, doesn't matter. If the county dispatches us for a second mutual aid call, we have to decline that because we retain that second ambulance for the city. And in order to take that ambulance out, we have to remove a person off one of the fire trucks to drive that ambulance because it's only staffed by one person. Just the way our staffing goes. So that then would be obviously a whole nother issue if we were to send that ambulance out. If something drastic happens, like a bus rolls over, bad example, but everybody comes to those calls, something might change. The chief may say, go, and we'll call resources back in. But on a normal day-to-day operation for the city, we would refuse a second mutual aid call if needed, so we can retain something for our community. And I think that's probably what Joe might allude to, or any of the other communities, is that I have 2 or 3 ambulances. I believe you have 3. So they theoretically could send 2 out, but then do they have the manpower to staff that 3rd for their own community? That's a logistical thing.
Oh, we gotta speak through the microphone so we can record it. Thank you.
Well, and again, there's really different regions in our county, and we have different levels of resources. You know what I mean? We've never refused to go on a mutual aid call. As long as we have an extra ambulance, if we can get a crew, we'll always go to help our neighbors. We are sometimes disappointed in the way the system works, and that I think that if the system could be more efficient, we could move around from town to town to help each other out in a much better coordinated system that tells where an ambulance, which town's available, which town has 2 crews that day. We often can get out for second calls. We even get out for third calls at times. And we're ready to help out other towns at any time. And I really think that a more efficient mutual aid system could probably help out a town that can't staff that day, and that's the way it's been working out.
That has been the way it's working out. And I know you guys, you'd never say no. You'll always go, right? I watched that time and time again. But my concern is under the system that's being proposed, if a town can opt out, EMS is not an essential service. So we could face the actuality that a town could opt out, not enter into any kind of a mutual aid situation, and simply sit there not investing in their EMS, but knowing that their neighbors are always going to show up. So we have to address that. I'm still going. Hang on a sec. And then I have a question about.
Nobody said anything.
Oh, Craig was waving.
Okay.
I have a question about a lot of our current districts do fundraising. I don't know how much of their income is through fundraising, but under a municipal system, we would lose the capacity to fundraise. So I'd like to know how much funding for our system in total we would be losing if we can't go out and ask people to give donations. So that was it.
I don't know if that's relevant to this. I mean, what
Why wouldn't it be
their own
relevant?
squad. We're not going to take the identity away from the agencies. We're not going to say it won't be Johnsburg EMS. They can still function as Johnsburg EMS. They could still fundraise to do anything they want. We're not taking away their identity. That was one of the issues before, where people were trying to say everybody's got to come into the same umbrella and be one thing. We're talking strictly starting out small to find a workforce that these agencies, rather than going to Kena staffing, the workforce would come from Warren County versus Kena staffing. I know Supervisor Bruno and then Supervisor Leggett.
Thank you, Mr. Chairman. I think this is a discussion that's long overdue. I don't think you're looking for any resolution here
No.
today, are you? And this is a great starting point, but it's just that. There are questions being raised here today that can't be answered and won't be answered until, first of all, to your point, you define the district.
Who wants to join?
Exactly.
Who would be interested in joining? Even if they don't want to join, in order for us to do financial, we'd have to know.
Exactly.
Exhibit A, Exhibit B. Yes, I want in. No, I don't want in. And then we could get into more of how you would fund the district. And it's not just going to be funded by taxes.
Right. And like I said, I think I applaud you for a good start here.
Oh.
It's just that. And I wholeheartedly support it. Thank you.
Thank you. Supervisor Leggett.
Thank you, Mr. Chairman. Got where I was going to go on this. There was I'll look over here to Horicon, see if perhaps North Warren would be one of the first ones to opt in. And if we opted in, then it's just like that. All the sticks out of that beaver dam out of the culvert that we took out this morning. There's going to be a rush. And when you have a secured EMS like North Warren EMS would be under this plan here, then we fill the ranks. And what that does is leaves other agencies dry. So, once things start flowing, what does it do to the rest? But I would say that because EMS right now is 40% of our tax levy in our A fund in the town of Chester, we are looking for a new solution to this, and we'd be willing to pitch in and go for this. Since been involved in this since 2018, and I really think it's time to move. And with discussions with the captain of the EMS and hearing all these things, it's time to move. And if we move, somebody else is going to be sucked into this movement.
Mr. Chairman, just, wouldn't the town boards have to decide? I mean, can the town supervisors make a decision for the whole board?
Absolutely not.
Okay,
It's a town by town decision.
yeah, that's all I was saying.
Yeah.
Yeah, so they've got to go back to their towns and each town will make that decision. Yeah. Okay, I didn't know if you're asking to bypass that or not. I couldn't figure it out. Okay.
Hey,
Absolutely not.
right.
Because there have to be discussions with the agencies too.
That's.
And we've had discussions with the agencies, and some of the agencies have told me it's time. They need help. They need help doing this. And I think it's time to put this forward. Not everybody wants to do it.
Yeah.
You're going to ask the town supervisors to go back to.
We're going to take it to the towns and
That's
say,
discussion.
only if we can move forward with this. Only if we as a county board want to move forward with this. And then we'd have to go to the town boards and say, do you want to join into it?
Well, how can we move forward if we don't know what towns want to get in? Isn't the first step is the town supervisors go back, ask their town boards where they want?
I suppose we could wait
That would be-
and do it that way and then start to work on a district. But I'd like to start finding out the legalese to working on a district right now. We can look into that and find out. It's just researching, doing a EMS district.
Right.
It's been done in other areas. So
And developing a certificate of need. If I may add in the 6 years that I've been in office, the EMS cost has increased 148%. That's more than anything else in our whole budget, 148%. And it's not going to go down anytime soon. We will need a certificate of need for the county.
that's correct. But it's not their fault that it's increased because there are no volunteers out there. Supervisor Hogan.
So Supervisor Leggett acknowledged my next question. Timing wise, if we're bringing it back to our boards and we're talking about a countywide certificate of need, is that something that needs to go through the state legislature? Or is that just simply something we apply for? How long does that take?
What's that?
How long would it take to get a countywide certificate of need?
I'm not really sure, but I think based on where we are, I think we could work through the Department of Health to see if we couldn't fast track. There was a county certificate of need at one time, and I don't know if it still exists.
It does.
It does still exist. And as far as doing a district, I would ask the legal people to find out through the state legislators and go through our senator and our assemblyman, because they're doing it at other places where we need to find how we can do that. And you can take it to your town supervisors and ask them to bring it up to their town boards and see if they were interested.
Can I follow on?
Let me have them.
Hi, I'm Ashley, new employee at OES. I've done EMS for the last 12 years. I thoroughly appreciate you guys having this conversation. It means a lot to touch on CONs. There are various versions because we are a municipality. We can apply for the municipality CON, which has a lot less red tape and is much easier to gain.
Closer to the mic.
Sorry.
I hear you with the muffler.
Can you hear me now here?
Yeah, go ahead.
So there are various types of CONs you can go for. The one that we would probably have to start out with is called a muni CON or a municipal CON. It's you apply to the regional council, and based on certain mechanisms, they award it to you or don't award it to you. Then you there prove from there that you can maintain an ambulance service, provide for the communities or whatever you're going after. There is currently a county CON. There is one agency that currently has it.
Any other questions
Thank you.
for Ashley?
There's a year delay
for DOH approved, you have to prove that you serve.
Correct.
Supervisor Hogan, you had another question?
Yeah, thank you, Ashley. Very quickly, I know for my town board to bring this back, they're going to want numbers. And I know, I feel like we're in a vicious circle here. But is there any way that we could take the time to work up some preliminary numbers before we're being asked to go back with a conceptual question for our boards?
What kind of numbers do you want?
They're going to want to know, is this going to cost us more than what we're currently paying? And they're going to want to know if that's a guarantee of the same level of service also. So
I guess I would ask Anne Marie if she can reach out to the squads and get their current schedule, and then we could probably work up some kind of what the employee cost would be.
thank you.
Yep. Anybody else? Just again, your name for the record, thanks.
Again, Damon from Glens Falls. So in relation to your last question, I had written down a couple of questions. Some may have an answer easily. Curious to know for a budgetary starting number, you had mentioned 3 to 4 million. What each town currently has to fund their EMS system, and what portion of that goes towards staffing. So my understanding is that the county would provide staffing. North Warren would retain paying for their ambulances, paying for any of the additional supplies initially, but you'd be paying for staffing to provide those coverages in the surrounding communities. So if North Warren pays, let's say it comes down to 10 cents per thousand and your total budget for staffing is $100,000 a year, could you in theory say North Warren would contribute 100,000 into the system by taxes, well, however you want to, obviously some taxes are going to be a little higher in different areas. But if you say got 100,000 from North Warren, maybe 50,000 from Bolton, that's what they pay. And look at what that number is, what the individual agencies pay right now for that coverage, and say, maybe that number is 2 million, maybe it's a little bit more. And my guess is that the county could probably do it in totality for less, but that might give an idea of where you're looking for a starting number. And then that can tell you where you need to go per thousand for like that tax district.
Right. We've been trying to get those numbers from the squads, and some have been more forthcoming and some have not, but we're working on that. But who else had a question? Supervisor Thomas.
I don't have a question, but I'd like to thank everyone for this topic coming forward again. I have an EMS person on my town board, and he continually tells me that one thing the county could do, like right now, is with procurement. And for the smaller districts, it's hard to, we get charged a whole lot more money for supplies than the larger districts. So if the county all come together with the procurement for the supplies for the ambulances, et cetera, it would save everybody money, I would think. And I would think that's something that we could do without a district and anything else.
Yes, if we knew, I've talked to Julie about that already. I've had that conversation with Julie. I thought we sent out feelers to at least through the towns to find out what supplies they would need. And, the EpiPens were a big cost not too long ago. And it certainly makes sense to work through. I mean, we do it with fuel.
Right.
We do it through our communities with fuel, and we do that for our EMS agencies. We've made strides to try to cut the costs at the local level, but you're right, Frank, we could do that.
Yeah, just a follow up, if I may.
Sure.
Chairman. Yeah, I discussed that same thing with Julie a couple of years ago, in fact, how to try to cut the cost for the EMS in the different towns. And I think she had, sorry, my memory is not great, but she had a real challenge there getting the information, I believe. So she couldn't get it all together to make a one type of buy and so forth. But maybe that's changed. That was a couple of years ago when I chaired the shared services committee. So that's something to look at again, Frank.
Right.
Yeah, I mean, any way we can save money for the towns in that area, we should be doing.
Right. Anybody else before I wrap up? Because I have a few things to offer. Sure.
Again, Tom Ordway, Local 2230. For those of you who question whether or not your towns have an issue, I strongly encourage you to go to these agencies and request a pager. All right. Listen to the county dispatch for a week and listen to the number of times your agency is getting toned. Listen to the number of times your agency is getting retoned. Listen to the number of times the county is saying, you have reached the mutual aid mark. What do you want to do? And I strongly encourage everybody in here to do that. Don't let these agencies tell you that, nope, we're all set. We're good. Listen for yourselves. Okay. Since we've been here, I just looked it up. Since 12, sorry, let me pull it back up. Since 12:01, it's 20 minutes. There have been 7 EMS calls just in our county. So, huh?
7-0?
7, just 7. So in 20 minutes, you have had 7 ambulances go out for, what's that? Out of 12 agencies, you have 7. And that's including Lake George, Warrensburg, Queensbury, Glens Falls, and Bolton. All right, so there's an issue here. So don't let somebody else tell you. Listen for yourselves. Request to have a pager. Just say, hey, I'm on the town board. I want to hear what's going on. I want to hear where our money's going for. Can I get a pager for a week? Listen for yourselves. Listen to those calls at 2 a.m. Listen to those calls at 6 p.m. Listen to those calls every day to hear what is actually going on.
Yes. Okay, I'm going to wrap up. And I've had a pager for 51 years.
You hear it.
And I'm a little disappointed. I understand folks worry about cost, but I worry about getting the service out to communities. I've talked to these people. You know, I did it for 25 years when you didn't have to have the training that they have to have. It's time to do this. If you don't want to belong to it, that's fine. But we cannot stop this from moving forward. We will get the questions answered. I've asked Anne Marie, we'll put pressure, and it will be up to the town supervisors to go to your squad captains and operations people and say, provide this information to Anne Marie so we can do it once and for all. I'm telling you, Warrensburg's going to be all in. We're one of the biggest, probably the second busiest squad in the county. We have a health center up there that generates a lot of runs. It's time to drop the barriers and do this. I implore you folks this is the right way to go for the residents. You'll be failing your residents if you don't do something like this. And if we go one more time by not moving on this, shame on us. Then every community will have their own district and you'll still have the competition with one another and you're not going to be any further along. And you may not create more people to want to go into the EMS. So you can either keep the blinders on and say, I'm okay. And Tom, you're absolutely correct. And I know that the ones that say that they're okay aren't okay. They're not okay. And I've listened a lot. And think about that person over in the dispatch center, dispatching 20 minutes for an ambulance or going from municipality to municipality. And it happens more than you would believe. But it's been on these people over here to try to get that person to staff their ambulance in the summertime when our population swells up. And I applaud the ones that you don't think you need to do it. I applaud you. I applaud you that if you have a great system, keep your great system. But there's a lot of them that don't have a great system and that we need to fix. And it's up to us to help them fix it. I feel it's up to us. If you don't believe it, that's fine. Supervisor McGowan, last word.
Thank you, Mr. Chairman, and heartfelt and said very well. One, these departments need the benefits that come with the hard work that comes with it. But my recommendation is, can we ask the EMS and Anne Marie to put that start it and start asking those questions to the supervisors so we can start putting together. I know I don't sit on the committee, but I'd be more than happy to sit here and share this, because you're absolutely right. Supervisor Connolly brought this up years ago, and it's time that we move. And unfortunately, the numbers mean a lot to, the constituents that we have to represent too. So, but coming together with those numbers and and if it is a countywide, all right, the benefits that come to these hard workers is really the important part. So.
Thank you. With that being said, we'll try to schedule a meeting within 30 days. I know that's a lot of work for Anne Marie to try to garner the information. I would suggest you go to some of the town supervisors, because we do have the budgetary numbers that came in preparing our town budgets. Most of us should know what the run data is from the squads. And there again, I'm a little disappointed, because I hear I know we're asking questions, but it seems to me like we're asking questions where we can just not do this again. And I just don't think that's the right way to approach it. So that I'll ask for an adjournment. So be it. Thank you.